Hello guys, welcome to our channel. Thanks for tuning in. In the next 5 episodes, we'll be having CPC practice questions that can help you pass your exam. I welcome you to the first episode of the Medical Coding Game. Please hit that like and subscribe button for more updates about the medical coding world. And here are the categories for this game. First, we have Diagnosis Mania, all about ICD-10-CM coding. Next is Skin to Skin. We'll be covering topics from your 10,000 series. Third is Bone and Tone, your 20,000 series questions. Fourth is Breathe In, Breathe Out, all about respiratory system. The next one is My Heart Will Go On, all about your cardiovascular system. And lastly, we have Mission Digestion, all about digestive system. The first category that we'll be discussing today is Diagnosis Mania, all about ICD-10-CM coding. Here is your first question. You can pause the video if you want to answer this one to find the answers in your book. All right. Timer starts now. What is used in ICD-10-CM when two conditions cannot occur together? Example is congenital versus acquired of the same condition. All right, so let's answer this question. All right. So this one requires you to check, or if you memorize your guidelines in the ICD-10-CM book, it's fine. But the easiest way how to get this question correctly is by simply checking your guideline section under your convention, check section A. All right. So go right here under your excludes notes. So under your excludes notes, guys, you just have to check for these two types of excludes note. You have your excludes 1 and excludes 2. But most of the guidelines and questions will appear from this guideline right here under excludes 1. So basically, if a certain code has excludes 1 notes under it, all right, that means you cannot code them together, all right? So it's written here in capitalized letter. The book is like shouting to you, not coded here. So it indicates that these two conditions cannot occur together at the same time. You can query the provider if the doctor thinks that the circumstance when the two conditions are unrelated to each other, all right? But again, if it's not clear, always query the provider. But basically, if you have excludes 1 note, you cannot code them together, okay? Congratulations on your first question. So the answer for this one is letter. What is excludes 1? That's going to be letter C. All right. So let's now proceed to the next one. All right. So this is going to be worth $400. This money is just imagination. Okay. I will not be providing you a price, of course. All right. Of course, the learning is enough. Okay. For this episode itself. All right. So let's now proceed to your second question. A 27-year-old man is experiencing headache with dizziness. The provider documents auditory vertigo of the left ear. The doctor diagnosed possibility of Meniere's disease. So what are or is the diagnosis you will be reporting for today? Timer starts now. Okay, let's now answer this question. So few things to check here. What is the chief complaint? That's going to be headache and dizziness. The doctor documented auditory vertigo of which part? The left ear. So take note, laterality is important in your ICD-10-CM coding. All right. So again, it will be indicated if it's left, right, or both ears in some cases. But let's check. The doctor diagnosed possibility of Meniere's disease. Things or terms like possibility, possible, probable, maybe, I'm not sure, 50%. So those are terms of uncertainty, right? If the doctor is uncertain with the diagnosis itself, it cannot be coded, all right? So therefore, you can go to either the signs and symptoms present or the more specific code here, or the more specific diagnosis, which is auditory vertigo. All right. Now, you have R codes here, R42 and R51.9, which are your headache and dizziness. So eliminate these two right here. Most probably you'll eliminate letter D as well because it's added and coded with your H81.02 here, which is your Meniere's disease. Meniere's disease will not be coded because it's your possible diagnosis only for this day. Please take that into consideration. Eliminate this. You will be left with H81.312. All right. So that's going to be your oral vertigo or auditory vertigo of the left ear. This is very important. Laterality is a must for this type of questions. Congratulations for getting this question correctly. All right, that's gonna be worth $400. All right, so let's now proceed to the third question, worth $600. A single view x-ray is performed for pain in the right index finger. This is the first time the patient visited this provider. The radiology report shows a fractured proximal phalanx that is dislocated. Timer starts. All right, let's now check the answer. Okay, so for this one, guys, all you need to do is to check what happened. What's the chief complaint? You have your pain in the right index finger. So take note, guys, that if it's about the musculoskeletal system injuries like this, you just have to check the specific part, all right, wherein the injury happened, so or the condition is happening. So you have your pain in the right index finger, and then check the result of the radiology here. You have fractured proximal phalanx that is dislocated. But before we go to your answer, I just want to show something here. So go to your ICD-10-CM guidelines and locate in the second paragraph of your guidelines for letter C, coding of traumatic fractures under chapter 19. A fracture not indicated as closed or open should be coded to closed, and a fracture not indicated whether displaced or not displaced should be coded to displaced. So do not forget about this important guideline here. All right. So you have a patient here who has fractured proximal phalanx that is dislocated. So it was not mentioned here if it's displaced or not displaced. So you will be coding this one as displaced according to the guideline that I have shown you earlier. All right. So displaced proximal phalanx fracture. Okay. Now let's go and check your letter A here. It looks like letter B is out because if you have dislocation and fracture of the same sites in the same scenario, you just have to code your fracture. All right, which is a more severe case than your dislocation. So eliminate letter B here. Let's go to letter A, S62.640. All right. Your S62.640 is your non-displaced fracture of the proximal phalanx. Number one, it's mentioned here as non-displaced. So as I've told you guys, it's a displaced fracture we'll be coding here. So we will be eliminating letter A. All right. Although it's not listed, it's not written, it's displaced, but that's the default. Okay, that's the guideline. Let's go to your letter C, S62.610A. All right, let's just say you didn't eliminate letter B here. Okay, all right, S62.610A. So let's go a little bit backwards. Displaced fracture, yes. Is it proximal phalanx? Yes. Is it right index finger? Yes. So go. Everything is complete. Proximal phalanx of the right index finger, which is displaced. So we'll choose letter C. So congratulations for getting that $600. So let's now proceed to the fourth question. Patient is in the facility today for a screening cystourethropy to detect cancer. The provider found a polyp in the bladder and removed it immediately. So what's the code that should be reported? Timer starts. You can pause the video here. Okay, so let's now answer this question. All right. So you have a patient who is here for a screening procedure. take note that if the chief complaint is screening, all right, you may have to code your Z codes here, even though there's a definite diagnosis that was found. For example, in this case, there's a polyp that was found, all right? Because according to the guidelines of your Z codes, all right, so, all right, if it's a screening procedure that's done, all right, for that patient, if it's the chief complaint of the patient, rather than going there for a diagnostic testing, which is different from screening, all right? So code your Z codes if the screening exam is planned, all right? So please take note of that. Just like in the question earlier, all right, the screening procedure was done. If, all right, if there is a finding of the doctor for the screening procedure that was done, you will be coding that as your secondary diagnosis. So please take note of that, okay? All right. So you have some Z codes here under letter A, C, and D. So you have Z12.6, all right, versus your D41.4 here. So again, if you will check letter B, it's totally out because the reason for visit is screening, right? And you will definitely eliminate letter D because it's a standalone code. There was a finding of the doctor here called the polyp, right? So the only question here that you need to ask again, compare letter A and letter C, is the sequencing. You have D41.4 here, which is for polyp, all right, of the bladder, which should not be coded as your initial diagnosis because there is a planned screening visit of this patient, although there was a finding diagnosed by a doctor. So you will be coding and choosing letter C for this case. All right, so I hope it's clear, guys. Take note of that. So you have this. Should a condition be discovered during the screening, then the code for the condition may be assigned as your additional diagnosis. Okay, let's now proceed to your fifth and final question for $1,000. All right, here is your question. A patient underwent abdominal aortic aneurysm repair last week and presents today with post-op congenital heart failure. What's the code that you will report for this visit? Timer starts. Alright, you can unpause the video. So let's find out what's the answer and how it should be solved. Okay? You have to check what's the current condition of the patient today, not the condition that was treated long time ago or just last week, just like what we have in this scenario. You have abdominal aortic aneurysm, but it was repaired last week, and there's no evidence that the patient has it today. All right? So that's number one reminder for this scenario. Okay? Now let's check your CHF or congestive heart failure code. All right? We can find that under I50.9 if you will check your tabular index. Okay? So I50.9 is your CHF. So that's going to be your code that we'll assign. However, are we going to code it as a standalone code, or should we code the past condition of this patient? Or if there's any status code or any type of previous abdominal aortic aneurysm diagnosis that we can find from the choices. Take note, guys, that if it's a cardiovascular procedure, some codes might appear in your I codes even though it was repaired already last week, right? Or if there's some sort of complications that arise, okay, from that specific condition that happened before. But let's check your I97.121 real quick, okay? Your I97 codes are, let's check, okay, intraoperative or post-procedural complications. Now, let's check I97.121. All right. Post-procedural cardiac arrest following other surgery. Is it cardiac arrest that happened? Or if you go here at the bottom, you have your I97.13, post-procedural heart failure. All right. So following other surgery. That other surgery was your abdominal aortic aneurysm repair. All right. So we can eliminate this. All right. It's codable for the post-op complication because That is the reason why, all right, the patient has congestive heart failure as explained under this word right here. Okay, so if you will check I-97.131, you can see I-97.131 on both choices. So you have your C and D here. However, there's a code here, I-71.4. So just simply go to I-71.4, which I suspect, of course, it's the abdominal aortic aneurysm. But it's already repaired last time, right? So you don't have to code it anymore today, because all you need to do is to code the complication plus the reason or the complication code, which is your I-97.131. Eliminate this, and then I hope you've chosen letter delta. Okay, so that's going to be your answer. So congratulations for winning $1,000. So we'll be having more of this next time. So next category will be your skin to skin. So again, it's going to be for integumentary system. And I hope you like this video. Tune in for more episodes like this in the upcoming days. Again, that's it for this evening. So long. See you next time. Always remember, without knowledge, there is no power. Have a nice day.